Did you know that nearly 1 in 8 people living with HIV don't even know they have it? That means there are hundreds of thousands of people out there, many of them men, who are walking around completely unaware they're carrying a virus that can quietly damage their immune system for years. The scariest part? The early signs are often so subtle, so easy to confuse with everyday illnesses or even stress that they go unnoticed until it's much harder to treat. Today we're going deep into the silent signs of HIV most men ignore, and more importantly, how you can recognize them. Because this isn't about panic or paranoia, it's about knowledge and awareness. HIV today is not the death sentence it once was. With early detection and modern treatment, people can live long, healthy lives. But the key word here is early. The earlier you know, the better your chances. So, let's start with the basics. HIV stands for Human Immunodeficiency Virus. Its main job, if you can call it that, is to attack your immune system, specifically the CD4 cells, also known as T helper cells. These are the cells your body relies on to fight off infections and illnesses. When HIV enters your body, it begins making copies of itself and slowly destroying these immune cells. Without enough CD4 cells, your body becomes vulnerable to diseases that a healthy immune system would normally handle with ease. But here's where things get tricky. The early stage of HIV infection doesn't always scream, "Hey, I'm here." In fact, it can be totally silent for years. This is why testing is so important, but also why awareness of subtle signs matters. Because sometimes your body does try to warn you. You just have to know what to listen for. Let's talk about acute HIV infection, which usually happens 2 to 4 weeks after exposure. This is often referred to as the body's flu-like stage. Imagine you've been feeling fine, then suddenly, boom, you come down with what feels like the worst cold or flu you've had in years. Fever spikes out of nowhere. Your throat feels raw and sore. Your muscles ache like you've been hit by a truck. At night, you wake up drenched in sweat, your bed sheets sticking to your skin. The lymph nodes in your neck or armpits swell up, and you feel an overwhelming fatigue that makes even getting out of bed a chore. Now you might think, okay, I'll just rest, drink some tea, and I'll be fine in a few days. And you would be, because in many cases, these symptoms fade after a week or two. And once they're gone, you're left thinking it was just a passing virus. But what's actually happened is that HIV has made its initial move and is now setting up shop in your body. This is one of the reasons so many men miss this stage entirely. They feel sick, recover, and never connect the dots. After this initial burst, HIV enters what's known as the chronic stage. This stage can last for years without any obvious symptoms, but that doesn't mean nothing is happening. The virus continues to replicate, slowly chipping away at your immune system. And while you might feel generally okay, subtle changes can start appearing. Changes that are easy to overlook or explain away. One common sign is getting sick more often. Maybe you notice you're catching colds back to back, or that minor infections take longer to heal. You might develop persistent sinus infections, bronchitis, or skin infections that seem unusually stubborn. It's tempting to blame these on stress, poor sleep, or just getting older. But if it's happening more than usual, it's worth paying attention to. Unexplained weight loss is another red flag. And I'm not talking about dropping a few pounds after skipping the gym. I mean noticeable weight loss without changing your diet or exercise habits. This can happen because HIV affects the way your body absorbs nutrients even before you're aware of it. Digestive issues are also more common than most people realize. Chronic diarrhea lasting more than a couple of weeks, for example, isn't normal and should be checked out. You might also develop sores in your mouth, painful ulcers, or thrush, which is a fungal infection that shows up as white patches on the tongue or inside the cheeks. Skin changes are another subtle clue. Rashes that come and go without an obvious cause, or sores that take a long time to heal, can sometimes be linked to a weakened immune system. These rashes can be flat, bumpy, red, or even itchy, and they don't always respond well to over-the-counter creams. For men, there's another often overlooked symptom: low testosterone. HIV can disrupt hormone production, leading to reduced libido, erectile dysfunction, fatigue, loss of muscle mass, and even depression. But because these symptoms overlap with stress, overwork, and aging, they're easy to brush off. If HIV continues untreated, it eventually progresses to AIDS, acquired immunodeficiency syndrome, where the immune system is so weakened that it can no longer fight off infections effectively. At this point, the symptoms become much more obvious and severe: chronic, unrelenting fatigue, rapid and unexplained weight loss, prolonged swelling of the lymph nodes, a persistent cough or shortness of breath, frequent fevers and night sweats that keep returning, opportunistic infections, illnesses that don't usually affect healthy people can start appearing, and they can be life-threatening. But here's the most important thing to understand: you cannot tell if someone has HIV just by looking at them. A person can look and feel perfectly healthy while living with the virus. The only way to know for sure is through testing. Modern HIV tests are quick, painless, and extremely accurate. Many clinics offer them for free, and in some places, you can even get an at-home test kit. Now, if you test positive, it's not the end of the world. In fact, it's the beginning of taking control of your health. With antiretroviral therapy, or ART, HIV can be suppressed to the point where it's undetectable in the blood. When it's undetectable, it can't be passed on to sexual partners. This is known as U equals U, or undetectable equals untransmittable. People living with HIV who stay on treatment can live just as long as those without it. So how do you protect yourself in the first place? First, practice safer sex. Condoms are still one of the most effective tools we have. Second, consider PrEP, short for pre-exposure prophylaxis, which is a daily pill that reduces your risk of getting HIV by over 99% when taken consistently. Third, get tested regularly, especially if you have new or multiple partners. And don't underestimate the power of open, honest conversations about sexual health. Asking about testing isn't awkward, it's responsible. It shows you value both your health and your partner's. HIV thrives in silence, when people don't talk about it, when they don't know the signs, when they avoid testing out of fear. But the truth is, the earlier you detect it, the more power you have over it. Silent signs can be easy to miss, but knowledge puts you one step ahead. So don't wait for symptoms to scream for your attention. Listen to the whispers your body might be sending you. Get tested, stay informed, and protect yourself. And if this message resonated with you, share it, because you never know whose life it might change.